When performing venipuncture, which of the following veins should be avoided unless no other site is available? A. Median cubital vein. B. Cephalic vein. C. Basilic vein. D. Dorsal hand vein. Answer: C. The basilic vein lies close to the brachial artery and major nerves, increasing the risk of injury or hematoma formation. It should only be used as a last resort. During an EKG procedure, the ground electrode is typically placed on the A. Right arm. B. Left leg. C. Right leg. D. Left arm. Answer: C. The right leg electrode serves as the ground in a standard 12-lead EKG setup to reduce electrical interference and stabilize the reading. A patient reports dizziness after a venipuncture. The first action by the medical assistant should be to A. Offer water. B. Lower the head and raise the legs. C. Call emergency services. D. Remove the tourniquet immediately. Answer: B. Lowering the patient's head and raising the legs improves blood flow to the brain, helping relieve dizziness or fainting. Which of the following best represents a correct chain of infection sequence? A. Pathogen host reservoir transmission exit. B. Reservoir exit transmission entry host. C. Transmission pathogen host exit. D. Host entry reservoir pathogen. Answer: B. The chain of infection begins with a reservoir, followed by exit, transmission, entry, and a susceptible host. The correct angle for intradermal injection is approximately A. 10 to 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer: A. Intradermal injections are given at 10 to 15 degrees to ensure the medication stays within the dermal layer for proper testing or absorption. A patient's blood pressure reads 86/58 mmHg. This would be classified as A. Normal. B. Elevated. C. Hypertensive. D. Hypotensive. Answer: D. A systolic reading below 90 and a diastolic below 60 indicates hypotension, which may cause dizziness or fainting. Which additive in a blood collection tube prevents clotting by binding calcium? A. Heparin. B. EDTA. C. Sodium fluoride. D. Thrombin. Answer: B. EDTA binds calcium ions to prevent coagulation, making it ideal for hematology tests. Before performing ear irrigation, the medical assistant must verify A. The patient's body temperature. B. The presence of ear tubes or eardrum perforation. C. The patient's hydration level. D. The patient's medication list. Answer: B. Irrigation should not be performed if there's a perforation or ear tubes, as it may cause infection or damage. The correct sequence for removing PPE is A. Gloves, gown, mask. B. Mask, gloves, gown. C. Gown, gloves, mask. D. Gloves, mask, gown. Answer: A. Gloves are removed first to prevent contamination, followed by the gown and then the mask. A medical assistant documents QID in a medication order. This means the drug should be administered A. Twice daily. B. 3 times daily. C. 4 times daily. D. Every other day. Answer: C. QID stands for quarter die, meaning 4 times a day. Which laboratory value is considered critical and should be reported immediately? A. Hemoglobin 13g/dl. B. Glucose 200 mg per deciliter. C. Potassium 6.5 milliequivalent/L. D. Sodium 140 milliequivalent/L. Answer: C. A potassium level above 6.0 milliequivalent/L can cause life-threatening cardiac arrhythmias. What is the main purpose of performing medical asepsis? A. To eliminate all microorganisms. B. To reduce the number of pathogens. C. To sterilize instruments. D. To maintain normal flora. Answer: B. Medical asepsis aims to minimize pathogen presence and reduce infection risk, unlike surgical asepsis which removes all microorganisms. A patient refuses treatment. The medical assistant should: A. Persuade the patient to continue. B. Document refusal and inform the provider. C. Proceed with treatment anyway. D. Leave the room without explanation. Answer: B. The refusal must be documented accurately, and the provider should be notified immediately. Which pulse site is most commonly used to measure heart rate during CPR? A. Radial. B. Brachial. C. Carotid. D. Femoral. Answer: C. The carotid artery provides the most reliable pulse detection during cardiac arrest in adults. The best needle gauge for venipuncture in adults with average veins is: A. 16. B. 18. C. 21. D. 25. Answer: C. A 21 gauge needle allows efficient blood flow without damaging the vein, ideal for standard venipuncture. Which action violates the HIPAA privacy rule? A. Discussing patient information in a private office. B. Leaving patient charts visible at the front desk. C. Using password-protected computers. D. Faxing results to a verified physician. Answer: B. Leaving patient information in public view is a clear HIPAA violation. Which injection site is preferred for infants under 1 year old? A. Deltoid. B. Gluteus medius. C. Vastus lateralis. D. Dorsogluteal. Answer: C. The vastus lateralis muscle is safest for infants due to fewer nerves and good muscle development. Which of the following abbreviations indicates before meals? A. AC. B. PC. C. HS. D. PRN. Answer: A. AC means antecibum, or before meals, while PC means after meals. A patient with a history of syncope should be positioned in which way during a procedure? A. Supine. B. Semi-Fowlers. C. Prone. D. Sitting upright. Answer: A. The supine position prevents falls and promotes blood flow to the brain if fainting occurs. A tourniquet should not be applied for more than: A. 10 seconds. B. 30 seconds. C. 1 minute. D. 3 minutes. Answer: C. Tourniquets left longer than 1 minute can cause hemoconcentration and inaccurate test results. When handling a urine specimen for culture, it should be: A. Kept at room temperature. B. Frozen immediately. C. Refrigerated if not tested within 1 hour. D. Mixed with antiseptic. Answer: C. Refrigeration preserves specimen integrity and prevents bacterial overgrowth before testing. The first link in the chain of infection is the: A. Portal of entry. B. Susceptible host. C. Reservoir. D. Pathogen. Answer: D. The infectious agent initiates the chain, requiring control to prevent disease spread. The abbreviation IM stands for: A. Intramedullary. B. Intramuscular. C. Intraoral. D. Intramucosal. Answer B. IM injections deliver medication deep into muscle tissue for faster absorption. The medical assistant notes a pulse deficit. This means A. The apical pulse is slower than radial. B. The radial pulse is faster than apical. C. The apical pulse is faster than radial. D. Both pulses are equal. Answer C. A faster apical than radial pulse indicates a pulse deficit, suggesting weak heart contractions. Which of the following is the correct body mechanics when lifting a heavy object? A. Keep back straight and bend knees. B. Bend at the waist. C. Keep knees straight. D. Hold the object far from the body. Answer A. Proper lifting requires bending the knees, keeping the back straight, and holding the object close to prevent injury. A provider orders 0.5 milliliters of a vaccine to be given intramuscularly in the deltoid. Which needle length should the medical assistant choose for an average adult? A. 3/8 inch. B. 5/8 inch. C. 1 inch. D. 1.5 inches. Answer C. A 1-inch needle is typically recommended for IM injections in the deltoid of average-weight adults to ensure the medication reaches the muscle layer safely. A patient on warfarin presents with bruising and bleeding gums. Which lab test result should the medical assistant review first? A. CBC. B. INR. C. A1C. D. BMP. Answer B. The INR, International Normalized Ratio, measures blood coagulation in patients on warfarin. Elevated INR indicates an increased bleeding risk. While drawing blood, the medical assistant observes that the blood stops flowing into the tube. The next best action is to A. Pull the needle out slightly. B. Push the needle further in. C. Replace the tube. D. Remove and reinsert the needle. Answer C. A vacuum loss in the tube is the most common reason blood flow stops. Changing the tube first helps confirm if the issue is with the vacuum or needle placement. During an emergency, a patient is unresponsive but has a pulse. The medical assistant should first A. Begin chest compressions. B. Start rescue breathing. C. Call for the provider. D. Check blood pressure. Answer B. If a patient has a pulse but isn't breathing, rescue breaths should be initiated at a rate of 1 breath every 5 to 6 seconds while monitoring pulse. When processing autoclave instruments, which indicator ensures items have been properly sterilized? A. Color-changing chemical tape. B. Moisture detection strip. C. Time and temperature chart only. D. Biological spore test. Answer D. A biological spore test confirms complete sterilization by verifying that all bacterial spores have been destroyed, providing the highest level of assurance.